a new patient comes in from a marketing initiative, for example, implants, you need to refer the implant out or they're coming in for a complimentary consult, but you need to refer them out. How do you retain that patient within the office, like just to keep them as a patient, so you're not just going through them and they're not becoming a patient in the practice?
Yeah, that's a good question. So if, let's say, I'm marketing for implants and I need to refer the case out because it's too complex and I want to make sure they come back for their hygiene appointment, let's say.
Yeah.
Right? Look for ways to make it stick. Like if they have another dentist, have them sign a records release while they're there. So you can then tell the patient, hey, okay, so now you're switched to our office. We've got your records from the other office. Let's book your next visit. Have something tangible in the books. Like make something definitive happen in their mind that they understand, okay, you're coming here now. Then you make a referral. I mean, it's probably not going to be difficult for a dentist to explain the referral side of it. I mean, that's straightforward. Like it's complicated. It needs a surgeon or whatever. So we're going to do this. But then you're going to come back and we're going to, and so often you're referring out the surgical component, not the actual prosthetic component.
Right.
And so having personally been burned like this before, what you want to do is you want to see if there is a way where you can have the patient put some kind of a small deposit on the final work. That, we're going to need to do this correspondence with the surgeon, and we're going to need to do this and this. So we just ask for a small deposit of whatever, $100, and it's going to be credited to the work that we're doing. Like it's part of the procedure. Like your total procedure for the prosthetic component is $5,000. So we just ask for, whatever, $100, $200 now to cover off the, time that we're going to spend in the process. And then the rest of it you just pay when you do it. Because otherwise what they do, it's only happened to me one time to figure out how stupid it was that I didn't do this, is they go and they get the surgical component done, then they go shop the prosthetic side. Well, I'm an idiot because I didn't collect anything on the prosthetic side. So I did all this time and energy and, dealing with the surgeon on how we're going to restore it and stuff. It's mostly just time. But still, like if you're a dentist and you're billing time, you can't give it away. Not very much of it. So that became a system right away. It's like, if I'm going to do this, then if they're supposedly coming back to me for the prosthetic side, let me put some money in the till for that. Because if they don't, then I'm going to just leave it be. Like, okay, then, how are we going to deal with the surgeon, right? Like, so I'm going to refer you, but the surgeon's going to have questions and is going to need to know what the final prosthetic's going to be. So I need to be the one that tells him that. And so while I'm doing that, there's going to be some correspondence back and forth. I need to spend some time talking to him. I may need to send him these models that we took and so on. So part of the total fee you'll pay today, whatever amount you want to take down, that's like minimal but significant enough that they're not going to walk away from it. And that's how I would approach it. So that's the only way you can tie them back on those kind of cases. Records release is a big one too, because it creates a definitive break in their mind from where they were going.
Right.
Okay. Yeah, that's how I would approach it.
Perfect.